Hi, this is Dr. Farley, and this is the November offer for the category of depression, anxiety, bipolar patients. Even PTSD patients can be thrown in there as well. I view them very much the same in the sense that the brain is not working properly. We do not approach these problems from a psychological component. That's not our approach. We approach it from a biological component, meaning why is the brain not functioning properly? And one of the things that you want to understand is a lot of neurodegenerative diseases like Parkinson's, dementia, Alzheimer's, Lou Gehrig's disease, multiple systems atrophy, any of these alpha-synucleinopathies, many of these begin with psychological symptoms. So these neuropsychiatric symptoms, in my opinion, is a continuation of neurodegeneration. There's massive evidence that some of the first signs that show up in neurodegeneration is depression and anxiety. We also have evidence that patients with bipolar have a 700% increased risk of getting future neurodegeneration. Patients with sleep disorders have a major increased risk, 80% of getting future neurodegeneration. And lastly, there's just research that came out that when we do MRIs of patients with bipolar disorder, what we see is that there's actually, the brain is shrinking. The brain is going through a neurodegenerative process. So if you do not get at the mechanisms of action as to why your brain is behaving like this, and all you're told is that you have a genetic problem, and there's a chemical imbalance inside your brain, and here's your drug to take this, I don't believe in any way, shape, or form you're addressing the true root functional causes. So the offer for this month is our normal bronze biomedicine program is $5,295. For the first 7 callers that get in touch with the office by the valid date that's posted by 4 o'clock that day, you'll get this program that for $995. And what this program will include is a complete specialty brain blood testing that looks at 30 different brain proteins to see brain and body proteins, to see if your own immune system is attacking these proteins or attacking your brain. Is there a sustained inflammatory component driving your depression, anxiety, bipolar, PTSD, even schizophrenia? And if there is, then what can be done about it? And this blood test here that looks at 30 different brain proteins, we're going to go over the 7 different areas. We look at brain proteins, number 1. Growth factors, important proteins that are important for the brain to grow and regenerate. Enteric nerve enzymes and neurological peptides. Pathogens, germs, chemicals, foods that can create cross-reactivity with the brain. And lastly, blood-brain barrier and neural filaments. If you go on to PubMed and you were to type in depression and inflammation, depression and autoimmune, anxiety and neurodegeneration, bipolar and neurodegeneration, bipolar and inflammation, you'll see there's thousands and thousands and thousands of articles that are now talking about biological causes for why our brain feels and behaves the way that it does. And it has nothing to do with psychological reasons whatsoever. So if you'd like to take me up on this offer, again, first 7 people that call by 4 o'clock of the date stamped, you will get this offer for $995. That is normally $5,295. If you want to start to uncover some of the real reasons for why your brain is behaving like this and not look anymore at these psychological theories that have no blood tests, no testing, no nothing, except a lot of theories, then I'd give us a ring. Tell them that you want one of the 7 spots. Hopefully they're available, and we can run this testing on you, and from there tell you what it means. We sit down face to face. You get a complete report, a complete review of what it means, and you get some basic recommendations from that as to what you can do to try to work on this and get this to function better. And lastly, most important, is you get some real hardcore evidence as to why your brain is behaving the way that it is, not based again on some psychological theories that have never been proven, and there's no science to substantiate that. So thank you. I hope you found this interesting, and look forward to hearing from you. Once again, be thankful. There's always a reason to be thankful. Have a great day.